If your child needs medication, there are only a couple of medications that are currently approved for use in the pediatric population. There are a number that are being studied, but there are only a couple that are approved. The one that is most widely used as the first line of treatment for type 2 diabetes in pediatric patients is metformin. You may also know this as glucophage. And it has been used in adults for many years, and it's been approved in the pediatric age range now for probably 10 years. And it's viewed as being relatively safe and relatively effective, especially in the context of changing some eating habits and increasing physical activity. Sometimes we will use insulin in children with type 2 diabetes. Sometimes when we first meet people with type 2 diabetes or children with type 2 diabetes, they're very, very sick and they have their pancreas isn't completely working normally and it kind of doesn't know what a normal blood sugar is. And in those circumstances, we will often use insulin for a few weeks to a few months. And then once the child's blood sugar has been fine and the child has perhaps lost a little bit of weight and the family is starting to be a little bit more active, we will transition them to the oral medication metformin. For older children, so we're now talking about 18 to 21 year olds, we use almost all the medications in that population that are used in the adult population for the treatment of diabetes. But for patients under the age of 18, we pretty much limit ourselves, at least for initial treatment, to insulin or metformin.